Rosemary McGinn here. I'm so excited to chat with her. She has a very interesting set of experiences, both as a healthcare provider and as a patient. So, welcome, Rosemary. Can you let us know just real quick where you live and what is your relationship to arthritis?
Well, thank you so much for having me. I live in Georgia. I live in Cumming, Georgia, or north of Atlanta here in the Atlanta metro. And my relationship to arthritis is I was diagnosed with psoriatic arthritis when I was 15 years old, about, I think it was 2008. So it's been about 15 years, which I thought of you because I think on your account you had just said you've lived half your life with arthritis now.
Yes.
I have now made that milestone as well.
Wow. No, it is. It's a trippy thing to think about. Yeah. And I would love to delve into your diagnosis journey slash saga. What were your symptoms and how did you get diagnosed?
When I was my first symptoms were, I wrote about this, and I know you're going to link it. I was at a Jonas Brothers concert, which was that was my thing. I love the Jonas Brothers. And I wore I had no backstage passes. I was not going to meet them, but you could. I had to prepare just in case. So I didn't wear, walking shoes or anything like that. I didn't think I had to. And so I wore cute like ballet flats and walking and standing the whole time and everything. So after that, my one of my toes, middle toe, got swollen, and now in hindsight I know now it was the very textbook sausage like digit is what they would call it. That's what I would know now. And it was swollen constantly, but it hurt, pretty bad in the morning, the toe and kind of the ball, or the ball of the foot. It would hurt in the morning, and I'd go to schools in high school walking around all day, and it would fade. It would actually improve throughout the day, which was a little confusing because you kind of almost every day you're like, it's getting better, and then no, it's not. But the
Yeah.
swelling was constant. So obviously my parents were concerned. I let them know, and they thought maybe I'd injured it. So I went to a podiatrist, who was a really great guy and really perceptive, and that was one of, I think, noting that to him, that it hurt the most in the morning and the pain faded, was a clue to him. And also I had psoriasis. We already knew that. So he asked that to me. It seemed like he asked that out of the blue. He was like, "Do you have psoriasis?" And I was like, "What am I here for? I'm here for my toe. Like, what are you talking about?" But yes, I do. And he was the first person to say it. He said, "I think you have psoriatic arthritis." And that was like, what? Like, I'm 15. I don't know if you understand. Can you look again? Um, and that started the whirl. It was like, okay, then I got referred to a pediatric rheumatologist, and eventually, moved on to an adult, or, rheumatologist, and started treatment very conservatively at first with Mobic daily, which is Mobix is also called meloxicam. It's an NSAID. And I'm a nurse, by the way. So I love the generic and brand name meds I'll get into.
Actually,
um,
that's helpful because I often forget the generic names. So
yeah,
thank
so Mobic I think is the brand, meloxicam's generic. Um, and then when it wasn't until I was 18 that I started my first biologic, which was Enbrel. And then, but as we'll discuss, I've moved on from a couple medications.
Yeah, and you mentioned being surprised at age 15 getting a diagnosis like with the word arthritis in it. What were some of the other emotions that you were having at that time?
It was a lot of like feeling confused because I think my parents had, since my parents were obviously adults, I think they had a much better grasp on the whole picture here, or maybe the gravity of it. I thought it was like not no big deal, or I don't know. And
Yeah.
it's I wrestle with that still sometimes. I am always like, I don't want to be dramatic, but or so, I always am a little self-conscious of that. I don't want to make it seem like it's this big deal. And it didn't feel like a big deal at first. It felt like, okay, I guess I'm going to get a swollen joint every once in a while, but then I'll take a steroid pack, I guess, for a week, and it'll be better, and it'll come and go. And it didn't it didn't knock me down at the beginning. It was a swollen toe, and I started an NSAID, and that to me did not feel like a big deal. And I didn't have maybe a lot of perspective of this is going to be with me for the rest of my life. And I think my
Mhm.
mom did. And my mom is a nurse, or she's retired now, but she's a nurse. And her mother my grandmother and her sister, my aunt, both had and have RA. So she and my aunt was diagnosed, I think a little younger than average too. So it was there was a family history a bit there.
Mm.
So my mom was definitely familiar with it, seeing her family members go through it. Um, and I had wrote in a response, since my mom like cried, she teared up a little bit at an appointment one time because she just, and if moms do this, for their kids, you feel like everything your kids are feeling, I think, or you feel bad for them. And I remembered being like, Mom, get it together. Kind of like I didn't understand. So like I was kind of at that age where I don't know, I knew it was something, but it it was kind of a gradual oncoming for me, and there was a lot of, when I went to college at 18, I became a nursing student. I think going through nursing school started to give me another perspective, and it kind of continued from there.
That's so common, though, to not truly understand the nature of it, and it's kind of like a one of the support group members that has been in the alumni group for my Room to Thrive support group. She likes to say, just how she's been on the podcast before, but she likes to say, ignorance is bliss, but knowledge is power. So you kind of have that trade off. Similar to you, I actually didn't know that any of my systemic issues were due to rheumatoid arthritis until I was in occupational therapy school. And it wasn't even like that was a big focus in the textbooks. I just happened to connect the dots where we're talking about multiple sclerosis and autoimmunity and how that can cause fatigue. I was like, wait a minute. Is my fatigue, this is 6 years after my diagnosis, is my fatigue related to my RA? I thought it was just I overdid it last night or, So, I think that's, again, just for anyone else listening, it's sometimes you can be hard on yourself. Like, I wish I knew how serious it was, but I also think it's complicated. I don't know whether you have this experience, but sometimes the doctors they want to err on the side of like optimism. And they're like, oh, this is like, they'll say like, and this is true, it's the best time in history to be diagnosed with psoriatic arthritis or rheumatoid because there are such effective treatments, but it kind of glosses over. It's still, there's no cure, it's going to be with you the rest of your life. I'm sure we're planning, family planning, pregnancy planning, you have to think about this in every aspect of your life. Think about your career. So anyway, sorry, going on a side note, but I do want to delve into I know what people listening might have questions about nursing school, because that's a big question people have, is what kind of careers can I do with this condition and how you manage that. But first, I'm going to be linear with our schedule. We have questions we talked about beforehand. And one of the unique aspects of your story is that you've had a rare drug-induced lupus reaction to an arthritis medication. And this is something that, even though it's rare, it's good for patients to know that this could happen. So can you kind of walk us through what happened?
Yeah, absolutely. So this was, yeah, and I want to emphasize, like you said, it's very rare. I've read about it, now after the fact that I read about it. Really, the incidence right now among the class of drugs that I'll speak about, which are TNF inhibitors, which is a common drug class of biologic medications for arthritis, as I'm sure many of your listeners know. And actually, it's actually used with some like Crohn's and stuff too, and ulcerative colitis, just as another side bit. Um, it's I've read that the reported incidence is 0.1% of patients. So it's one of those side effects when they're reading really fast at the end of the drug commercial and they're like, this can happen, this can happen, this can happen. And you're not listening anymore and you're like, okay, it's kind of one of those. So it was not something I anticipated. Like I said, when I was 18, I started taking Enbrel, and then I was on it for 2 years, very well controlled, minor, infrequent flares. And then when I was 20, you are immunosuppressed on these medications to a degree. So I actually got strep throat, but I didn't know. I don't think I had it as severely as the symptoms didn't present as severely as they would have, perhaps, if I wasn't on an immunosuppressant, which is something I think people don't know too, that sometimes your immune system reaction is sometimes what makes you feel sick in a way, sometimes. Um, and I think that's kind of what happened to me in this case when I got strep throat. I didn't know. And if you leave strep throat untreated for a while, it can cause some problems. So I got petechiae all over my body, my trunk, like my torso. and which are like the small like red dots all over me. And but also my psoriasis flared like crazy. I got a head to toe psoriasis reaction. So this was not the drug induced lupus reaction. This was a combination of things going on, where they then found out I had strep throat. They another really perceptive doctor that I went to at the time, um, so I got an antibiotic, but there was the psoriasis was flaring too, and then the joints were flaring. So they said, you know what, I think it's time for you to come off Enbrel. Let's try a different biologic. I think Enbrel's run its course for you. And that's an intimidating thing too, to have to switch your medication. And because they're, I think you know that, like you get a little attached to it and you're like, okay.
Oh, completely. And I just want to point out that you on the blog post, I don't know if it's called a blog post, but on Medium, you wrote an article called Sensible Footwear, a year's long journey for a diagnosis. You have some pictures of what happened to you. And I think these pictures are really illustrative about what you're about to talk about as well. But they're pretty severe, and I have a hard time visualizing in my head sometimes. So I recommend you look at the link in the show notes, or just go to medium.com and look up Sensible Footwear as a year's long journey for diagnosis. Okay, keep going. Sorry.
Oh, sure. So, and I didn't mean to get into the Enbrel so much. So anyway, they were like, well, you got to switch. Why don't we try this one called Humira? And I think Humira had maybe at that point been out for almost maybe 10 years. But anyway, I said, okay. And so that was when I was 20, and great, again, back under control. Everything's fine. We're back to the status quo. And it was very similar medication and subcutaneous injection. I don't remember if it was every month or every other week. I can't remember now.
I
And it
think it's
depends.
one that it's variable.
Yeah,
Sometimes
it depends on your
every other week.
dose.
Yeah, yeah.
Yeah, so I don't remember, but similar to Enbrel, very similar the way you administer it, all that stuff, and same drug class, a TNF inhibitor.
Hmm.
So I took it for 4 years. Well, for 4 years total. But so when I was 22, going into age 23, I was working as a nurse in a hospital. And that's when like arthritis symptoms started to kind of be a little more like I started to have a little bit more fatigue. I was having pain after work in my feet, my legs. And but sometimes you say to yourself, well, I have arthritis, so what do I expect? So I wasn't too upset about that, but I was noticing like at the end of, you stand a lot in the hospital, and with working with patients, which I'm sure you know in your work as an OT. Um, so that I was noticing some red dots, kind of not a lot, but a little bit sprayed across my feet at the end of the day, but they'd be gone by the morning. If I slept, they'd be gone. So that was kind of for me like a whatever. And I moved on. Like I don't know. I think I ignored a lot of things in hindsight. And
Oh, that's so common too, though. People often say like you never know whether you're overreacting or underreacting when
exactly.
you go to the
And
doctor.
sometimes too, even with when I like I said, I was feeling more tired. Sometimes I'm like, am I tired because I have arthritis, or am I tired because I'm a human and everybody gets tired? You know what I
Yeah.
mean? So you also feel like I don't want to jump at everything that happens. But so when with those, they would kind of come and go, and I was like, okay, some red dots, whatever. But it was then this bump appeared on my knee. It was on my left knee. It was kind of flesh colored, kind of pink. Painless, just a bump. It was my skin. It wasn't part of the joint. It wasn't part of it. It was very much on the skin. And I didn't know what it was, and it wouldn't go away. I waited probably at least a couple weeks. So I went to my PCP, and he was like, it might be an abscess. Like maybe you had an ingrown hair or something like that. Maybe it turned into an abscess. Why don't you take an antibiotic? Like conservative approach first, which I appreciate. So he was like, take an antibiotic. And I was like, okay. So I did, and it did nothing. So I went back to him, and I was like, it's still here. And so he took a biopsy, and he told me it was an abscess. He said, it's an abscess. So you just need a different antibiotic. This one didn't cover it. This one will. And I just didn't believe. I don't know why. I really can't explain to you why I knew that it wasn't an abscess, but I knew it wasn't an abscess. I was like, it's just not. And I can get into it later as to why he may have thought it was an abscess, because the bottom line is that it was fluid filled to some degree. But that's kind of a whole other part of it. There was a neutrophilic sort of drainage in it. Um, but it was much more than that. It was not an infected abscess. It was an inflammatory thing going on.
Hmm.
So or a different sort of inflammatory thing, maybe I should say. But I was young and impatient, and I didn't like having ugly things on my skin. I was well controlled with psoriasis. I mean, Enbrel and Humira had my psoriasis almost non-existent most of the time. So I just went to a surgeon. I was like, I don't care. I went to a general surgeon. He can just remove it. This is small, no big deal. And that's how he felt too. I said, can you just, I don't know what it is. Can you just get rid of it? He's like, sure, for sure. So that was an outpatient, just sat in his office. He local anesthetic. Um, okay, cut it out. He's like, I'll send it for pathology. I mean, I'll let you know, but it's gone. And I said, okay, I had a few stitches. And he called me with the pathology, and he was like, it's some kind of, there was a little bit of necrosis, but he thought the necrosis was from the previous biopsy from the PCP. And he was like, but also just inflammation, nothing specific. I don't know, weird. And I was like, okay. And I didn't care, as it was gone, I didn't care to pursue it more.
Right.
Except it wasn't gone. So
No.
it was not gone. And yeah, I guess disclaimer, here's one of the first kind of medically gory pictures you might see on the blog post. It grew back much bigger than it originally was. They removed the stitches, but there was kind of a drainage point with the stitches that never closed. I went back to him to say, hey, this isn't closing. He put some silver nitrate on it, which is a little treatment you can use to close little things like little openings in the skin like that, I guess. And he said, it's fine. It's a little cautery method. And he said, it'll close. It didn't. And the whole thing grew back multiple times bigger. It maybe was the size of a pencil eraser. Now it was the size of a ping pong ball. And I was like, oh my, like it, not only did it not go away, it got so much worse. So the first lesson I learned was I kicked myself so much because I already had psoriasis. I already had skin problems. I should have gone to a dermatologist first. I don't know why I ran to a surgeon. But like I said, I was impatient, maybe, and I was worried about the looks of it. Maybe I don't know. So
Hindsight's always 2020. I have to remind myself that every day, know better, do better. And
absolutely,
now your story, by sharing it, you're maybe helping others make different
yeah.
choices too. So
Don't necessarily run to cutting into yourself right away,
that's
especially if
just,
you have
it's just such a
inflammatory
nurse
stuff.
thing. And my
I
sister's
know.
a nurse, so I feel like you're so tough. You're like, sure, cut me
Well,
up.
I just
Like,
like
no big deal.
I was like, just do it, whatever. I don't know.
Yeah.
And this is no discredit to the surgeon. He did
Yeah.
exactly what I asked him to do. He was like, I can get rid of it. Sure. That's what I'm here for. So anyway, obviously I was like, lesson learned. Let's not do that again. But more concerning now, and also simultaneously, another bump appeared on my elbow, which was my left elbow. So now I'm like, oh my gosh, this is crazy. And now a lot of things, when you if you care to read the blog post, this keeps it a little linear. In my head it's hard for me to explain it all because this was happening around 2017-ish. But it from 2016 to about 2018-ish, this is kind of all taking place, and it gets a little jumbled in my head. But so the bump on the elbow shows up. I've got the bad one on the knee is grown back. And now a lot of things are happening at once. At the same time, those red dots are still happening, if you remember, that I talked about, but they're kind of ever so slowly and gradually getting a little bit worse, or taking a little bit longer to fade, or hurting a little bit more. Like I could, instead of just seeing them, I could kind of feel that they were coming on while standing or things like that. So I went to a local dermatologist where I was living in Indiana at the time. And I saw a dermatology nurse practitioner, and she looked at them and she said, I think it's keloids, and we can inject them with Kenalog. And Kenalog's a corticosteroid, I think. It's a steroid. And she thought if we inject them locally, that'll calm it down. But just a note about keloids is keloids are something that are kind of a hypertrophic or an overgrown scar, but they're not, yeah, it's a condition that people have, but they're in response to an injury to the skin. Something
Yeah.
has to happen to the skin for a keloid to happen.
So
So
it wouldn't explain the initial appearance, but it would explain after the surgery it being bigger, but why did it happen in the
Exactly.
first place? Yeah, that's so
So
tough.
with the knee, you're right. It's that would track for the surgery, sure, but why was it there in the first place?
Yeah.
And with the elbow, there was no why would that be a keloid? I didn't hurt my elbow.
Mhm.
But I was like, okay, sure, do the catalog. And I was just like, yeah, you could be right, I guess. What do I know? I don't know. I wasn't working in, I'm a nurse, but I'm not, I don't know. I was working in GI at the time. I was very tuned into my GI things. I was doing
Mhm.
colonoscopies, assisting with colonoscopies and EGDs and things like that. Um, so we did, and actually, in hindsight, too, the Kenalog injections, although she was wrong about the keloids, Kenalog injections was a really reasonable approach, though, too, and was actually something suggested again down the line. So it definitely didn't hurt the situation. But we tried a lot of, like, several rounds of Kenalog injections, and just like nothing happened, nothing improved.
Mhm.
Um, and and also, I can't remember exactly, they all were slowly starting to pop up. I slowly, at some point, one came on my right knee now. And
Mm.
so I'm I called at one point, we had kind of stopped with the Kenalog injections, and I called her office and I said, I'd like to speak. Could we review this with one of the doctors? Not to insult her, but to like, can we like what we need to do something else. This isn't working and the other ones are appearing now. And they just didn't call me back. They did not call me back. You would call, you would get, the front office, maybe scheduler or assistant, or maybe they'd transfer you to a medical assistant or maybe a nurse. And they said, the office policy is we'll call you back in 2 to 3 business days. And I'd say, okay. And I'd wait 2 to 3 business days and they wouldn't call me back. So I'd call them again. And I probably called them with the waiting, the quoted amount of time. I probably called them 3 times and then waited and never got calls back. And this was before too, so again, this was like maybe 2017. I don't think I had a patient portal with them. I'm not sure that
Right.
that was so prominent then that you could just very easily, it definitely existed, but I don't think I had it with this office. So
Right.
I went to them, I went there in person one day and I was like, nobody is calling me back. And
Yeah.
again, I just walked up to the scheduling desk and they're like, well, let me go in the back and talk to somebody. And then they came back out and they said, they'll call you back. And I said,
No.
I'm like, okay. So I was just over, I was like, okay, I'm done with these people. They're not helping me. And now in the meantime, let's say now I've got another one now in my heel. One of my right heels come up. They're slowly coming up. So I go to, I was living in Indiana, but I grew up in the Chicago area. And where I was living in Indiana, it's only about an hour and a half away from Chicago. So I I was talking to my parents who were living in that area still, and my husband, we weren't married yet, but he was probably my fiance at this point.
Yeah.
He was very busy with work, so my dad and I got myself an appointment with a Northwestern dermatologist, and my dad took me to downtown Chicago where the office was. They were within the Northwestern health system. It wasn't like, the
Mhm.
university, it was the health system. I go see him and it's like it's a skyscraper. It's intimidating. I grew up in the suburbs. You have to go literally we like took the train, we took an L, we like walked a little bit and you go to a skyscraper and we were on the
Wow.
30th floor. It was intimidating. And he sees it, I kind of explain, and I have to note at this point, the dots, the vasculitis, they weren't present that day and they weren't yet
Oh.
so constant. They just weren't there that day because I
Mhm.
hadn't worked. I had slept well. I hadn't been standing for 12 hours. And I think I had mentioned them, but like I said, they weren't there. And I was more worried about these bumps. Those were the thing that were the
Mhm.
constant. And so he took a biopsy. So we're at like biopsy number 3. I don't know. Um,
I need a bingo board to fill out here.
I know
Like,
a lot
uh,
of biopsies.
yeah.
And so he was like, I will let you know. Like the biopsy will tell. Like it was like you got to wait for that. So okay. So he called me and eventually with those results and he was like, I think what you have is something called erythema elevatum diutinum, EED, which is a mouthful. And I was like, tell me more. And he was like, it's something that can occur in people who have existing autoimmune diseases or problems, which you have. So that tracks but it's benign. And he said, and I'll never forget the quote because I was talking to him on the phone, and I'll never forget it. He said, um, if it really bothers you, we can try to like, it was that phrase. If it really bothers you, we can try to do something about it, or we can, that you already know surgical removal doesn't work. You tried Kenalog injections. It's mostly cosmetic. It's, mainly it's benign for the most part. It's not something that's going to really hurt you. And I was like, oh, okay, I'm being dramatic. Like, I guess this is not a problem. I was
Yeah.
very sensitive, and I do want to like throw in again, I probably was more tired than usual. I might have been more sensitive than usual, more like I was a little hyper. So that I
Mm.
just was like, okay, I'm being sensitive, I'm being silly, or like I'm overreacting. Why am I pursuing treatment for this? This is just a cause I'm
Mhm.
vain. This is a vanity issue.
Oh my gosh.
So I was like, okay, message received, nothing to do about it, I guess. It's just something like psoriasis or something like psoriatic arthritis, where I just have to accept that I have another diagnosis on my list of diagnoses.
Right.
Um, so I was like, okay. Um, but so now, life is continuing, and they're on my feet now too. I've got a bump on the bottom of my left toe. I've got a bump on my I misspoke. My left big toe, my right second toe, the back of my right
Mhm.
heel, the outside of my left heel, and like I said, to recap, the elbow and both knees. So I'm like,
Wow.
what the these are coming up, like a new one is coming up every month or so. And now the problem cannot be ignored about the red dots anymore. They would last longer, they would take longer to fade, they burned. You couldn't
Yeah, and you really have to look at these pictures because when you're saying dots, this is they are extreme. Like you have pale skin. These are extremely red. I've had skin issues and I've never had anything this. Maybe when I had chicken pox when I was a kid, I don't know. But these are not just little looking like acne or something. So not to be like it's but I just
Oh, yeah.
yeah yeah.
So dots does sound like a euphemism, and that's they really did start as dots, but you're
Hmm.
right. The picture in there is when that's what I'm saying they progressed to.
Hmm.
That's when it couldn't be ignored.
Hmm.
They got worse and worse and worse to the picture you're referencing that was about as bad as they would look. And actually at times worse. You can see on that picture on the ankle bone, like the malleolus, that one had ulcerated into a wound at some point. It was standing was painful. It felt like my legs were burning. I'm sure all of this was contributing to fatigue. They themselves were painful, and they became raised too. They used to be flat, but then they became raised. It was really becoming like alarming, obviously. And in the meantime too, I decided to leave the hospital. I couldn't do the 12-hour shifts anymore, which was really emotional for me. It's actually kind of still emotional to talk about because I just felt like I couldn't do it. And I was, like I said, I was working in, they call it endoscopy, which is like mainly GI, some pulmonary, some random other things. But you had to be on call too, because sometimes overnight you might get an emergency. So, you share that, but you rotate on call and weekends overnight. But in addition to 12-hour shifts, I could not physically do it. And I was only like 23 or 24. And I just felt like such a like I just couldn't believe this was probably the first thing in my life that I felt like changed. I felt this was the first thing in my life that felt like an option was taken away from me because of having arthritis, which I don't know why in hindsight hadn't really yet connected to my arthritis yet. I knew that it was like, oh, I'm this person who's prone to autoimmune things, but I didn't know exactly what was happening yet.
Well, remember you keep saying you didn't know, but this is a 0.01 or 0.1% chance of happening. So if we lived our lives considering every 0.1% chance thing, we would literally never do anything because we would be just considering things all day long. So I mean, I'm very similar to you that it's really hard not to beat yourself up when when you find out things that connect the dots not trying to make a pun of dots, but yeah,
Yeah,
connecting the
pun
dots
intended.
in yeah, in retrospect. And I think that it's a very profound thing to work so hard for a career. And I mean, occupational therapy school was hard. Can only tell you the things I've heard about nursing school, how hard that can be. So at such an early age, have to give up part of it, give up part of your hopes in what a quote unquote normal 23-year-old would, dealing with things a normal quote unquote 20. I always say quote unquote because I don't like the word normal, but 23-year-old wouldn't not normally have to contend with. I guess I do like the word normal because I just used it like 5 times. But so
Well,
you're
and I see what you're saying with that. Yeah, and also what I thought in my head, which we can speak to later when you said you thought people might have questions about nursing school, I had a picture in my head of what I thought a nurse was and what I thought like being a
Mhm.
nurse was. And I thought so it was really it was hard to wrestle with kind of.
Yeah,
So
yeah.
I was really fortunate though, because working in GI at the time at that hospital, I was working with a lot of gastroenterologists who also had their own practice, and they had their
Mhm.
outpatient setting as well. So I applied at their outpatient endoscopy procedure center, which so I was doing the same job basically, but not in the hospital. I went to an outpatient setting where you don't have 12-hour shifts because it's an outpatient office. They're not even open for 12 hours.
Right, right,
You're just
right.
there at the regular business hours and no on call. So I wasn't on call overnight or on the weekends. And I did need to make that shift, but I mean, ultimately, I was still standing for good amounts of time, but not as physically demanding as the hospital. So
Mhm.
this was all it was we're hitting the point now where it was getting pretty like I was getting pretty down and emotional and anxious. And so anyway, I went back then to my rheumatologist in Illinois. Like I said, I'm from that area. And when I had moved to Indiana, I loved that. She was treating me since I was 16. I
Oh,
never
wow.
left her. Like I went to college in Wisconsin. I moved eventually to Indiana, and while I was in Wisconsin, while I was in Indiana, I only saw her every it varied maybe on how my condition was going at the time, but our regular
Mhm.
appointments were maybe every 3 months or every 6 months. It kind of varied, but I would always go back for her because my parents still lived
Mhm.
there. It was easy enough. So I went back to her in Illinois, and now see, I have to kind of cut the Northwestern guy a little bit of a break because he didn't see the vasculitis, like, which is what it was. Spoiler alert.
Yeah,
He
yeah.
didn't see the dots, as I've been calling them, like she did. She saw them in full. They weren't fading anymore. They were there.
Right, right, right.
um, so long story short, she referred me to the Cleveland Clinic, and that we had to wait a while to get in, but we got it through her referral, and I so in waiting for the Cleveland Clinic, the bumps that I speak of on my feet were opening into ulcerating wounds, and I was bleeding through my socks while I was working, and now I was going to local wound care too, and it was all just a mess. But now it felt like you just have to wait for Cleveland, they'll fix it. So we went, and I saw a rheumatologist who immediately got dermatology on. They were really, really good about like working together across specialties, which
Mhm.
is really hard to find
Yes.
in sort of the normal outpatient set. They're like a tertiary care center. When
Right.
you're just in the outpatient setting, getting your dermatologist to call your rheumatologist, or getting
The only time
specialties
that
to
ever happened for me was pregnancy because the stakes are so
yes,
high. Other than
right.
pregnancy, it's really hard for me at least. Yeah.
Me too with pregnancy. Yeah, I
Yeah.
did get my yeah, see. That's a whole we could get into that too,
Yeah,
right? We
yeah,
can
sorry.
talk
Yeah.
pregnancy and rheumatic things and
Yeah, that's
autoimmune
a
things.
yeah.
Oh man. But yeah, so they were really wonderful. Actually, her office was like on the 3rd floor and dermatology was on the 4th floor. So I mean, they were literally in the same building. They were a floor
Yeah.
apart. They talked to each other, whatever. So she got them involved immediately. But all the answers didn't come immediately. It was like we had to work this up. They thought they were going to test. They were testing me for RA. They thought maybe I had lupus. They
Mhm.
thought maybe I got like a chest X-ray for sarcoidosis or something.
Oh,
I
wow.
was getting more biopsies. They biopsied the quote unquote dots, as I'm calling them, and they biopsied the bumps again. So now we're on like the 4th biopsy of the bumps at least. So they pretty quickly the dots were that biopsy very pretty definitively, I guess, showed leukocytoclastic vasculitis.
Whoa.
which is like the mouthful for saying like inflammation of your blood vessels. But it was
Mhm.
for me, it was that vasculitis can sound like a scary thing because I know there are versions of it that like can affect organs and stuff like that, like a lot of
Yes.
internal stuff, and that's very serious. This, I'm not minimizing this, but it wasn't immediately life threatening or anything. It was my
Mhm.
skin. It was skin vasculitis,
Mhm.
but painful, painful
Yeah.
nonetheless. Um, so there's a lot of, we got to start treatment even before we have answers. And you kind of have to reconcile
Mhm.
with that. You have to just start taking the medications, even though you don't know what's going on. Um, so it was starting steroids. They, like I said, they thought, oh, methotrexate, maybe you have RA, but my rheumatoid factor was negative.
Mhm.
They were drawing it's called a lupus anti-coag panel,
Okay.
which this experience gave me a whole new, um, I don't, perspective, sympathy, like appreciation for people who go through lupus diagnosis. Cause I never knew how, I kind of thought there was a test for it and it's you have lupus or you don't. And it's very much not like that. I was not really familiar with the lupus diagnosis process.
Yeah.
Um, they
Well,
were
it was
so they were,
covered. Oh, sorry. I was just gonna say it's
no,
covered
go
on the
ahead.
show Dr. House, where they repeatedly like it could be lupus because it's such the great mimicker, right? It could look like so many other conditions. That's why I always think of when I think of the lupus
That makes
diagnosis.
me, I just recently listened to, Dr. Amigas, is that how you say it on your podcast?
Oh yeah,
And she was
yeah.
like, I get
I
to
mean,
be like Dr. House. Yeah.
yeah, yeah, yeah. But so like
So
yeah,
funny.
in this case, it's like rheumatology saves the day in the sense that like if nothing else from this story, I almost wonder, and sorry, not to be like just skipping ahead, but if people are thinking, okay, if you're having something weird go on, if you don't know whether or not it has to do with your inflammatory arthritis, when in when you have some sort of mystery, always get in the rheumatologist in the loop because you never know what's going to relate and what's not relating to your inflammatory arthritis.
Yeah, and again, in hindsight, you can tell from what I've said, I waited to involve my rheumatologist, and I'm somebody, I already had arthritis. I was already established with a rheumatologist,
Mhm.
and I did not go to her right away. I didn't she came later because I was like,
Well, I
"This is
would
a
think the
skin
same thing. I would think
problem." I was like,
dermatology, like, and I've had
yeah.
times where I've gone and I've had skin issues and the rheumatologist has just said, "Oh, that's a derm thing. Just go to the derm. It has nothing to do with your RA." So you just as easily could have been that. But yeah.
And I don't know too, maybe kind of being sort of in the I mean, being in the medical in as a nurse, you work with a lot of doctors, and some of the best people I've met, um, not all of them, but a lot of great people. But you are kind of privy sometimes to the like, oh, we can't deal. They think we can deal with this, but we can't. They got to call the other person or call the other person, and so you kind of like, oh, I don't want to be that patient, or so you get a little self conscious
Totally.
because you're on the
Totally.
other side of it sometimes.
Mhm.
Um, yeah, so anyway, it was like a 4-hour drive to Cleveland from where I was living in Indiana. They stayed in great they, by the way, I mentioned this earlier, they did have the patient portal function on the phone at that time, which was kind of like, oh, they are so high tech at the time. Because the sort of local offices at the time did not have that yet. They used Epic for their charting, they had my chart. It was so, oh, I got my lab results right on my phone. I couldn't believe it. Like, which that's
Yeah.
a double-sided, what's the
Yes.
expression? A double-sided edge sword, double-edged sword, because you get the results like before they even call you about it sometimes. And so
Oh
I'm
yeah.
like sitting here, yeah, you're like freaking out. You're like, oh my gosh, something's abnormal. And then they call you and they're like, oh, that's not actually that big of a deal, or
Oh, 100%. I had a brain MRI to rule out MS because I was starting to have some symptoms of MS,
oh,
but I wasn't sure.
scary.
Well, it was a confounding variable because yeah, I've been on RA biologics for a long time, which you can for some of them get MS as a secondary thing. But I also had that car accident in 2016 where I had a concussion and a neck injury. So if you're starting to get dizziness, is the dizziness most likely it's the concussion post concussion, but you don't want to say everything is due to the concussion when really you actually also concurrently have like MS. So I got the result and it exactly the same as you said. I got it through the portal and it's like we had saw it. I knew what an incidental finding meant. I knew that it wasn't a normally an incidental sign is something where they weren't looking for it, and it doesn't necessarily mean a huge deal, but it's a cavernoma and a cluster of abnormal blood vessels usually found in the brain and spinal cord. It was in my frontal lobe, and I could see it on the image. It's not like a tiny little weird thing. I was like, that's not normal, and
And
I
it's
freaked
your
out.
brain.
It's my
Like it's your
brain. And then,
brain.
of course,
Oh
the
my
neurologist
God.
was so blasé when I did the follow-up. Like, those rarely ever, nothing happens. You just get monitored occasionally and make sure they're not bursting into your brain. But even if they burst, they normally just stay localized. I'm like, well, if it just stays localized, I need my frontal lobes. Like, anyway, long story.
Oh, the
That's long story.
brain.
Yeah.
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 No,
Yeah.
that is the thing though. I was getting, and like I said, I didn't know what that like lupus anti-coag panel, that for people who don't know, that's like multiple tests kind of
Mm.
together. It's a
Mhm.
panel. And it was like some of them were normal, but some of them were abnormal. And I'm like Googling it, and my mom's Googling it because we're like,
Yeah.
they'd had, or it just comes through whenever. And you're like, you don't want to see anything abnormal, but of course you
No.
get it. And sometimes it's maybe indicative of something, or sometimes, like you said, maybe it's an incidental finding, or it's a, we could draw it again later. Maybe it was just a one off or something.
Yeah.
So
Yeah.
it
A
was a lot of
remnant. What do they
still
call that? Do they call it a remnant
yeah,
or
I
a,
can't think of, yeah,
there's a
maybe. I
word for
can't think of the
that.
term. I know, I was trying to find it myself. I can't.
Artifact. Artifact?
Yes,
Yes.
yeah.
Yeah.
Well,
Okay.
that's like, yeah, that's like on heart monitors, but yes, the
Yeah.
same concept. Yeah, I think that's what we could call it.
Yeah.
Um, so it was, yeah, it was a lot of constantly feeling like, do I have lupus? Do I have RA? Do I have so, and then I'm back in my head too. I'm like, okay, I have skin problems now, but these other skin problems. But now I also have some. If I have lupus, is it still that I have psoriatic arthritis, or did I never have psoriatic arthritis? Has it been rheumatoid this whole time? Like it was
Yes.
very confusing. And the way I'm talking about it, it sounds like this was all happening quickly. It wasn't. This was months and months of follow-ups and driving back and forth and
Mhm.
labs and whatever. So they knew it was vasculitis. I was on steroids for that. Like I said, they put me on Plaquenil because that's a lupus medication, and I think an RA medication too. Could be for either or both.
Yes.
Methotrexate they started, and then they also started something called Dapsone, which they thought could help the which I think, side note, might also be, no, I don't remember. I'm not going to say it because I don't remember. Um, but Dapsone was that was to target the bumps.
Okay.
But the problem with Dapsone, this is not a side effect. This is a known thing with Dapsone because of like the mechanism of the drug, or because of the, can't remember the word for this either, but just how the mechanism of action, I guess. It causes hemolytic anemia. It causes like the hemolysis of red blood cells. So that's not the kind of anemia where you can just eat iron rich foods and it'll be okay. It's like it's just what it is, I guess. So I took the Dapsone, and within 3 weeks, you're supposed to get your blood tested right before so they can establish a baseline, and then they'll test you again in a month. And I only made it 3 weeks before I started having terrible like symptoms, like very, well, not fatigue, like lethargic, and like terrible headache. And so I went to the doctor, and sure enough, I was like, my hemoglobin had dropped like over 3 points, and I was like at a 13 something, which is in the normal range. And then I was down to like a 10, which is below normal range, not horribly anemic, but I think the precipitous drop really maybe emphasized how terrible I was feeling. Um, so that drug was not working for me, which I've heard you talk about this on your show before, and this was a tough one for me too, because it was one of the ones that they had a lot of hope for, and maybe it could have worked. And I felt like I just can't handle it, and it's my fault because it's making me too tired, or it's making my head hurt. And I'm just whining about this medication, but you were truly anemic on it. And it's very hard for your body, I think, sometimes to compensate with that when it's not used to it. But then I think if I had stuck it out, maybe my body would have learned to compensate. So that was a tough one. But I
Mm.
ultimately stopped that medication. But anyway, and then they said after some time, they were like, let's resume like a biologic for your psoriatic arthritis. They had, by the way, I should say, I guess they had ruled out RA, they had ruled out sarcoidosis. And I do think at this point we knew it was a drug, and they did say, listen, we don't think you have lupus, but we think you're having a drug-induced lupus reaction to your
Right.
medication.
To Humira.
Humira,
Yes,
yes, to
specifically.
Humira, which now I had been taking Humira for 4 years. And this felt like I had been cheated on or something. I was like, what are you talking about? My medication did this to me because when I tell you it had my arthritis symptoms under control, I hadn't seen my psoriasis since
Yeah.
that incident I talked about when I was 20. I had not seen a past. So it had been so good to me is how I kind of felt. If I can
Yes.
like, and if I can, it feels like it's a person I'm talking about. It's a medication.
No, you've
It had
yeah.
been, it had
Betrayed. You
been,
got
yeah,
betrayed by it.
I was
Yeah.
so betrayed. I said, what are you talking about? Do you think this did this to me? I felt
What
so, yeah, that was very upsetting. And
yeah.
so they had stopped it during all of these testing. We had already discontinued it. And then they did, they landed on that sometime after they discontinued it. They're like, you know what? We do think this is what it is. It's a very rare side
And
effect,
oh, and I just want to, I'm putting this link, which was updated in 2023 in the show notes that about drug-induced lupus, but just to know that it typically goes away when you discontinue the drug. So it's not a permanent
yes.
case, which is a good, so it's reassuring to know that, I mean, hopefully no one will go through what you had to go through,
Right.
but there
But I
is
do want people to know I do not have lupus. Like this medication did not
Mhm,
give me lupus. I had
mhm.
some lupus-like symptoms for a period of time, which is what they attributed the vasculitis to. They said, we think you had a drug-induced lupus to reaction to Humira, and that triggered vasculitis in my skin. And then they said, okay, now separate from that, now you have vasculitis. We think the vasculitis is the underlying cause of these bumps, of this skin issue. So it's kind of like this, we had to follow sort of this chain,
Yeah.
um, this sort of chain reaction, I guess I should say. And so I'm like, okay, but we knew all of this, but we still didn't really know what the bumps were, and not sure what to do about them because surgery didn't seem like an option anymore. We already did Kenalog injections. I was already on high dose steroids for everything else. That wasn't systemic steroids. That wasn't doing anything, at least to the bumps. Um, and I was on all these medications. They're like, anyway, if we get your psoriatic arthritis now maybe back under control, let's just see what happens. So they started me on Cosentyx, which is a different drug class. It is not a TNF inhibitor. It's an IL-7, which is an
Yeah.
interleukin 7. And it's a newer, I've heard you say on your show before too, they're always coming out with new drugs, which is so
Yeah.
true. We're always having a lot of options come out. So Cosentyx it's not, very new now, but I still think maybe now it's less than 10 years old.
Yeah,
Um,
it's like the TNF inhibitors were the first class of
they
biologics.
were.
That's Remicade, Enbrel, Humira. And I know I've been on an IL-7. I'm trying to remember if it was Actemra. Is it Actemra or Orencia? I'm trying to look this up as we're talking. But yeah, they're the newer ones.
Yeah, so it was a little newer, and they were basically like, listen, don't ever take a TNF inhibitor again. It doesn't agree with you. Let's try a different class of drugs. Here's Cosentyx, give it a try. But so like I said, the vasculitis was still very much a problem. It was still definitely needing to be controlled with prednisone and things like that. So I was on a few different medications, a few different immunosuppressive medications to be exact. And I had these bumps where I'm calling them bumps, but they were draining. And we found out too is a neutrophilic drainage, which is kind of like a white blood cell drainage. Not really important, but the point is they would open sometimes, which is a source of infection, right? And I was on a lot of immunosuppressants. So I got a cellulitis infection in my elbow and the one on my left elbow. And I had been at work that day and my elbow was really hurting and it got worse and worse throughout the day. And I got home and I couldn't even bend it or straighten it fully, but I had long sleeves on. And I'm like, I don't want to look at this right now. I knew it was going to be something bad and I didn't want to look at it. So I waited till I got home and it looked infected. So my husband took me to the ER and it needed IV antibiotics. I was in the hospital for 5 days. The IV antibiotic, part of the reason it took so long was because the IV antibiotics gave me an acute kidney injury because they were so like intense. And the lab didn't draw my trough on time. It's a whole thing. But
Oh
which is because they're
no.
so busy. I don't blame the lab or the phlebotomist. They're always so like, they've got a million things to do all the time. Um, so
Oh, that's
anyway, and
so
by the way, an acute kidney injury, that was also a very temporary thing. My kidneys are fine. I don't have problems with my
mhm.
kidneys. But um
I mean, this is a lot. Like one day you're working and the next day you're
mhm.
hospitalized.
Yeah,
Like,
I texted my manager at the time who was really, really lovely person and really wonderful to work for. I texted her, and I had just been at work with her all day. And I was like, listen, I can't come in tomorrow. I'm in the hospital. I was like getting admitted. It was like the evening. She's like, what are you talking about? I just saw you like 3 hours ago. And I was like, I know, but like, and I was really transparent with her throughout a lot of this, because of how she was really wonderful and always, you know, treated me with a lot of respect in regards to this and gave me um, a lot of understanding, which I really appreciate. Like, I don't think everybody is lucky enough to be in a work setting where they'll afford you
No,
that
they're
sort of
not.
time off that you need, or just be understanding that I hated to call in sick. The time that I got anemic from the dapsone, I called in sick that day, and I obviously called in sick when I was in the hospital. And I really hated that. I hated having to do that because I just feel like my coworkers will see me as somebody who's not dependable. I'm going to make them short staffed today. They're not going to have the extra hands. It's something I really, that was another, that was like an emotional thing for me too. But it was something that I was beating myself up about, because I have to say again, like, my coworkers, my manager were really, really wonderful to me. Nobody gave me like a hard time about it, which I know I was really lucky for, because maybe not everybody has that.
Yeah,
Um,
and you would think I was gonna say, well, in healthcare, they understand, but that's not true. I've heard too many stories of people whose coworkers should understand who work in healthcare, you know?
Absolutely.
So that's
Well,
really
and part of this though, I think too, was because I was in the outpatient setting now. So I do have to say, I think if I had still been in the hospital setting, it is harder for people to have that maybe empathy sometimes in the hospital, because you are so short-staffed all the time. You're
Mhm.
overworked. The physical demands are crazy. The hours are long, and I've been on the other end of that too, where I before I was working in GI, I worked on a med surge floor, and if you came in one day and somebody had called in sick, it could be deflating. It wasn't, you
Yeah,
weren't,
yeah,
I didn't have anger towards the person, but you just knew how it was going to affect your day.
right.
And that's in that inpatient setting, right? So that's why I really just beat myself up about it. But again, this was outpatient, so the stakes are a little lower. Um, but
Yeah.
an inconvenience to everybody, I'm sure, nonetheless. So yeah, that's tough. But if anybody listening works in the inpatient setting and you have to call in sick, please don't feel bad about it. Like, nobody's mad at
No,
you personally. The conditions are just tough. Like, it's just grueling conditions, and I get it, and my heart goes out to you.
yes.
Um,
Yeah.
but yeah, so brief hospital stay, which was very much a bummer, and yeah, that was a low point for me. I was having a lot of pain at that point. The wounds on my feet were not good. The I It sucked. It
And
sucked.
then had you already gotten married at this point or no?
I had just gotten married. Yeah, my
Oh,
husband, and this was like through sickness and health, right? I had just
yeah.
gotten married. I think we were less than a year married by the time I was in the hospital. We
Wow.
got married sometime in 2018, and I was in the hospital January 2019.
Oof.
I say sometime in 2018, like, I don't know. It was April of
Oh,
2018.
yeah.
um, so it was less than a year.
Yeah.
And actually, my husband was a resident at he was he's a family practice. So he was in residency at the hospital that I was admitted to, because that's where we live near. And it was funny, like, a nurse came in to help me with something when I was or not to help me, but to, do whatever they had to do, give me medicine or whatever. And they saw him standing there, and they recognized him as one of the residents. And I think he was working that day, so he might have been wearing scrubs. And he was like, "Oh, I'm so sorry, you're rounding. I'll come back later." And he was like leaving. He's like, "No, no, I'm not. Like, come on." So
Yeah.
that like that was like a whole nother. I felt bad for him too, because he
But
was so busy. But
that's a grueling schedule though too, right? Like they're not home that
mhm.
often, like, so you didn't
It
did
was
you
the
feel
worst timing too, because he was on his so with family practice, they do different rotations throughout residency that vary from inpatient to outpatient to medicine to OB to pediatrics, but either in the inpatient setting or the outpatient setting, or they have elective rotations
Mhm.
maybe where they're learning about other things. He was on his medicine rotation, which is the like, you're inpatient, you're doing the medical floors, the adult, it's
The
that's
stakes
the
are high.
busiest one. Yeah, that's the
Yeah.
busiest one. Maybe they have to respond to the codes or something. It's the whole thing. So anyway, so that was tough. It was great. Yeah, so my husband, I have to give a lot of credit to him, because he was going through his own stressful time with work and, completing his residency training. and his wife's in the hospital, and his wife has like wounds on her feet, which he was many a time he was the person doing the wound care on my feet when I was just like over it and like couldn't even deal. So he obviously is one of the people I couldn't have gotten through all of this without.
Mhm.
So anyway, I hospital say comes and goes, and Cleveland is still following me, and so they invited me to a dermatology conference. They said,
Mhm.
we want to present your case to the attendees who are other dermatology professionals, I think mostly locally in the area, but we host these conferences, so would you come? So then they can look at you in person. And I was like, wow, well, yes. Because I thought, wow, what an opportunity. Like, we're going to get a think tank together of these people who surely somebody will know. Somebody will know the answer, or somebody will say, I've seen this before, whatever. And I really thought in my head, I was like, I'm going to get a sit in on this. I'm going to go to a room or a lecture hall or something, and they're going to put up a slideshow, and I'm going to get to hear all of their thoughts, everything they're thinking. And I'm going to be an active participant in this. And that was
Mhm.
not true. I got there, they put me in the appointment room that I had always been in, and they're like, we're going to go talk about you, and then we'll come look at you. I was like, okay. Which I
Wow.
do kind of understand. I mean, that is how they treat it for all of the patients with these conferences. I get it. But it was like, we're gonna go talk about you in the other room, and then all these people are gonna look at you that we just talked about you. And I was like,
So that is
okay.
weird. Like I
It
know
was weird.
rheumatology is really unique in many ways. And
Mhm.
I've been, a patient partner at the conference before, as well as speaking as an occupational therapist. And we've had patient representatives on panels, and they're treated as like equal partners. So I'm not to be like dermatology sucks or something, but no, just saying like it doesn't have to be done that way. Like it could be done
Right.
in a way that felt less like you're like a zoo animal they're just like looking at.
And it's funny you say that because that's how I right afterwards, I remember the term I was saying to somebody I was talking to about it, said I felt like a circus,
Yeah.
like, not like a circus freak or something. I felt like I was the attraction at the circus or something. I don't know.
I'm sorry.
So it was no, it's okay because I really did like I appreciated their efforts, and I appreciated them presenting me at this case. Like I was
Right.
grateful for that. But if I could change anything, I wish I could have been privy to the conversations because
Mhm,
it was,
mhm.
of course, I was interested. I wanted to know.
Right.
But so anyway, I sat, and she, I was this one, she was a dermatology resident who I spoke with the most, and she couldn't say enough nice things about her. She is so nice. She was like, okay, this is what we're gonna do. You're just gonna sit here. We're gonna go talk about you. We'll be back. And then here, let me open this poster. And it was this like trifold poster that you use at your science fair when you're like in junior high or whatever, that trifold, right? Like I had to do that in seventh grade.
Yep,
And they
yep.
had every picture they had taken of me, of the wounds, of the skin, of the vasculitis across this time
Ah,
period that I had been going down, which had been months. And I just started bawling. I lost it. I started crying. It was like the first time I had cried in front of any of these like medical
oh,
professionals. And because it was like it felt like I just got hit in the face with it. It was like I just got hit by, like, I don't know, I just got smacked in the face with everything that had been going on. And
yeah.
that was, like, one of the first times too where I was like, "Maybe I've been, like, ignoring the emotional aspect of this and burying my feelings a little bit," because it it was like it erupted. It was I just started crying, and I think she was a little taken aback. She was like, "Oh my god, I'm sorry, like, do you want me to close it?"
Mm.
And so that was tough, and I
Well,
was like,
it
"Oh."
kind of feels like to me, I'm imagining it was like that you put a frog in boiling water, it jumps right out. But if you put it in lukewarm water and you slowly turn the temperature up, it's like you had these things that had grown over time, and you're coping with it by saying, just get through the next week, get through the next day, get through the next hour. And then when someone presents you with this poster, it's like you're all of a sudden hit with the boiling water. You're like, oh my gosh. And I
Yeah,
always
and I,
say,
like
like, yeah. Oh, sorry. Go
no,
on.
you go, tell me. No,
Oh, I
tell
was
me.
just gonna say that something my doctor or my therapist finally convinced me of. He's a psychiatrist, so he's a doctor and a therapist, and he does clinically like hour-long therapy sessions, which I actually never knew psychiatrists could do that before I started seeing him. But anyway, he says, avoidance is a great short-term strategy. It's never a good long-term strategy. And so in this case, you're avoiding coping with your emotions because it's just too difficult in the moment, and you have to you're in survival mode. And then once it's resolving, you're giving yourself the space to actually confront it. Anyway, yeah.
Well, and that's it. So, and it probably was a good thing that something finally forced me to confront it, because
Mm,
I was kind of it. I think I'm glad to have heard you say that, because I don't think I put a name to it. I think avoidance is what I was doing. And I was like, it was the first time I had a lot of like, I felt bad for myself. Like I had a lot of I looked at all that skin and I was like, who is this happening to? This is horrible. Like it felt like it was pictures of a different person, but I simultaneously knew that it was me. So I suddenly felt so sad and like bad and like frustrated, and I started crying, and she closed the poster and they reopened it later. I was like, I'm sorry, I
mm,
can't look, it was too hard to look at.
yeah.
Um, but it wasn't a lot of time either to kind of get myself together, because like I was like, let me compose myself. So, she gave me some tissues and she was really nice, but she had to go present my case. So she left, and I, got it together. I had to roll up my sleeves and my pants and my whatever. You feel that this is where you feel like a circus attraction or whatever comes into play, because you're like, here I am. What do you
Mhm,
think? And it
mhm.
was it was like an hour of people cycling in and out of the room. And have you tried Kenalog? Have you tried Dapsone? Have you tried? I'm like, yeah, yeah, I'm trying it. I tried it already. Thank you.
Mhm.
So, and it was just a lot of wow, whoa, that's weird, huh? Huh? Isn't that just the darndest thing? And I was like, isn't it though? But can you help me?
It's like
So
it's like you're willing to do the emotional labor of sharing your story in return for hoping to get some answers. And then when you don't get the answers, it's like that trade-off suddenly maybe it doesn't seem as worth
yeah,
it.
so
That's rough.
yeah, so I think through all of that, they did land on, like, the diagnosis, but did not ever, and I'll get to this, I guess, but to this day, have not landed on a treatment or cure maybe.
Mhm.
Um, so they call it Palisaded neutrophilic and granulomatous dermatitis, PNGD. Don't
Mhm.
ask me to say it again. I'm just kidding.
I'm putting a link
It's
to it. I
long.
had to look it up. I had to look it up and I'm putting a
Yeah.
link to it in the show notes.
Yeah. Yeah, sorry, that's a long one. And actually too, if people read the blog post, I have some hyperlinks within there as well, for anybody who's interested in any of those further readings. But similar to that other diagnosis I had said of the erythema elevative diatom, it's kind of seen with people who have autoimmune problems, I think especially if inflammatory problems, not, technically harmful. Obviously, it's a problem if it's going to open up and cause infection or wounds. But limited research on it because it's very rare. But what they've known is what I've already said, basically Dapsone, um, Kenalog injections, maybe. One of the links had maybe another I don't remember what the third medication was, but I know it's one that I already had tried. They had run through it all. So this is actually a testament again to, before you have the answers, sometimes it's okay to continue with the treatment. Because even going back to that dermatology nurse practitioner, I mean, what we tried was not necessarily, that wasn't the wrong answer. We just didn't know what it was yet. So we
Mhm.
had already tried a lot of stuff. And in the again, the limited data, the limited research, they say some people experience spontaneous resolution. And I'm like, well, that sounds great. Um, and also treating the underlying disease. So I think psoriatic arthritis, drug-induced lupus, vasculitis, a lot of stuff was going on. Um, but we were treating all the diseases and they're still here. So basically, it was kind of like we were at an impasse, I guess. There was a point where a couple of the ones on my feet they were open wounds, and they did go away. Two of them went away. And one of them has gone away forever, and the other one grew back.
Mm.
And so to this day, I still have one on my right heel, my second toe on my right foot, the outside of my left heel, my elbow, and both of my knees. Those are all still here. However, they are not draining. They're like dormant volcanoes, I guess you could say. They don't
Mhm.
open, they don't drain, they're not wounds. So I do think all of that inflammation in my body was, we regained control over all of that. Um, but for whatever reason, I've not experienced the spontaneous resolution, or maybe the medications we tried didn't work. Maybe if I ever revisited Dapsone someday, there's a lot of, should I bother trying to pursue it still? Should I not? I don't know. I've mainly come to a place where I'm fine with it.
Mhm.
um,
Mhm.
it's a little awkward wearing shorts and sandals sometimes, and your feet and your knees look a little strange. But you come to accept that too. It's been years now, so
Mhm.
That's okay. Cosentyx is doing great for me.
Yeah.
I'm back to the no psoriasis, no, not a lot of joint flares. Um, a lot of, not a lot of pain all the time or anything like that. So
Yeah.
Cosentyx was the answer for me for my psoriatic arthritis for now, until the next, which may or may not happen. And the bumps are here. Maybe someday they won't be, but it's okay.
Well, and that is like I call it the chronic illness seesaw. Like I made this visual for
Mhm.
it a couple of years ago, but where you're like, it could be better, it could be worse. Like how much energy mentally do you spend or should you spend trying to get to the bottom of it and fix it versus how much energy should you spend adapting to it and saying, well, like the null hypothesis in science, right, is that things won't change. Like, is
Mhm.
that your intervention won't work. So what if it does? What if they never go away? I'm kind of hearing between the lines is that it's a tricky, and I don't think anyone knows the right answer. Like at the end of the day, I have to tell myself I did the best I could with what I have. Who knows? I could Monday morning quarterback it tomorrow and say I should have done this, I should have done that, but I can't. I'm already exhausted. I don't want to exhaust myself more by letting myself be haunted by the could have, woulda, coulda, shoulda. I'm just right now as we're talking, I'm finishing up the Taylor Swift themed episode that's going to come out this at this point when this comes
I
out. It will
love
already.
that.
Yeah, there's a song woulda, coulda, shoulda, and I'm like, it's hard not to be haunted by that. And so along that's really good. All roads, I would say, like all roads lead when you're dealing with chronic illness, they all kind of lead to, in my experience, like there's a emotional, mental health aspect, right? Where you're like, you get to the end, you get to a point where you're like, how do I cope with this? And so earlier it sounded like when I said avoidance, I mean, the way that my therapist explained it is like when you shove stuff down, like your emotions down, you avoid feeling them because you're like, I'll deal with this emotion later. I can't handle it right now. Um, and again, it's a functional short-term strategy that gets you through the day. But there's a saying in therapy, that which we resist persists, so it's gonna come back to you someday potentially. And so I'm always curious to hear if people went to therapy and how have you coped with the mental side?
Yeah, so during all of this, in the thick of it, I feel like this was kind of my acute phase. I was like, make no mistake, I was anxious and I was upset and it was hard. Um, so like life was kind of, my regular sort of days, but it was tough. So I did start therapy. I did it while I was still living in once we eventually moved from Indiana, but while I was in Indiana, I started therapy. It was around the time of my wedding too. I was also like a bride, like freaking out about my wedding,
Yeah.
but
Oh
also
my
having some
gosh.
other issues. So I went to therapy. I did briefly try an anti-anxiety medication, but this was right about the same time they were just telling me I had a drug-induced lupus reaction. So psychologically, and in hindsight, that was not a great idea for me because I was like, okay, I'll try this medication. And it was, we'll talk about drug class again. It was an SSRI. And when that was a primary care doctor who prescribed that to me because I said my anxiety's terrible, blah blah blah. And he was like, okay, I just, it's incumbent upon me to let you know about the side effects. You could have something called serotonin syndrome and blah, blah, blah. He got into all the side effects.
Mhm.
And I took that medication one day. And that night I had a blown panic attack about it.
Yeah.
And I was like, I'm
Yeah.
having serotonin syndrome and I fully acknowledge it was a psychosomatic reaction. I had I had just found out I had a very rare 0.1% drug induced lupus reaction. So I had convinced myself I'm going to have all the rare, medication. And I was already taking all these prednisone and I was already, it was
Prednisone makes
acting.
you so anxious, by the way.
Yes,
Yeah.
prednisone hypes you up. And I don't know if
Mhm.
people who haven't taken it or when you take the week-long pack, it's kind of not as much, but I was on like 60 milligrams of prednisone
Oh,
for
wow.
months daily. It was a lot.
Every day. Yeah.
I had the moon face. I gained some
Mhm.
weight. I was like a mess. So then
Mhm.
here I am. Oh, sure, I'll take this other medication. Who this doctor was just doing his job, let me know what the side effects were. but I had just also found out about this other side effect. So I assumed I was going to, you know what I mean?
You're like, my
So that
track
was a
record for rare things is
I
not
know.
good
I
right
was like,
now.
well, I
Yeah.
guess I'm going to get this too. And so
Yeah.
I had a complete mental block to it. I couldn't take it, which is not the fault of the medication. It was my experience and what was going on with me at the time. So I
Mhm.
abandoned that and I went to therapy, which was like, it was the only thing I could do at the time because I was not, I would have been just, oh, if I had to add another medication, you know?
I
So that was
totally get that. Yeah.
yeah, it was helpful for me. It was the first time I ever did it. It was eye-opening for me in a lot of ways because there was a lot of coping strategies I never knew, you know, existed, and those made a lot of difference for me, like, breathing techniques and the, like I don't know if you've ever heard of, like, the 4-7-8 breathing, if you start to
Oh
feel really
yeah.
overwhelmed, that's a big one for
I
me.
love
Love
that
that.
one.
Love it. And that really helps me feel that's like or maybe that's also a grounding technique, I'm not so I learned some grounding techniques to, like, feel where you, like, put maybe touch your fingers together, feel the ground, feel your surroundings. A lot of mindfulness stuff. I also have always loved doing yoga, so it was easy for me to sort of intertwine that with yoga. Maybe try some meditation. I don't do any like formal meditation, but just I think more mindfulness is maybe the way to describe things
Right.
like that I've tried. And
And before
um
we talked, you shared a few bullet points, and I latched onto this phrase you wrote, which is that mindfulness techniques, breathing techniques, and accepting that it's okay to not have control. That's one that I still work on. I have to work on that one every day because
that's a huge one for me
right?
too.
Because
Mhm.
control is so comforting. And as my therapist
Yes.
says, control is helpful if you have a controllable problem, but sometimes our problems are not controllable or not solvable.
This was the perfect example of that. It was like this long lasting issue, ultimately mostly temporary, but this kind of long ongoing like issue that yeah, like, and as I said, these as every with every bump that popped up on my skin, it was like I had lost a little bit more control because those were like, I'm not even doing anything. I'm just sitting here and bumps are popping up on my skin. You know, like I didn't
Yeah.
under it was so and I think I'm similar to you in that way that when I was in therapy, I was putting a lot of the anxiety, again, this was avoidance. I was putting a lot of the anxiety on my wedding instead of on this medical problem that was
Mhm,
happening with
mhm.
me. I said, it's just the wedding. It's just the wedding. Once the wedding's over, I'll feel better. Once the wedding's done and the planning's done and all that's done, I'll feel so much better. Because I also saw that as that was something I could control. I had a date for my
Exactly.
wedding. It was going to come, it was going to go, and it would be fine. So I was like, everything's going to be fine after the wedding. So I
Mm,
kept putting all of that on, it's just the wedding. And
mm.
my therapist was like, I think you have, yeah, issues with control. She was like, you have to be okay with not being in control because that's life, you know?
Oh my gosh. So I mean, that's such a beautiful thing that
It's
they
liberating.
yeah,
Yeah.
that the therapist felt comfortable bringing that up because I feel like it is really hard to tell a control freak that they need to not be in control because it's like the first response is like my first response to my therapist. I have had 2 therapists. One's female, she's a psychologist, and the other one's male, he's a psychiatrist. And she was, the first one that introduced me to this concept. I'm like, but what if I'm really good at being in control? And come on, like I just try really hard. And the thing is, people who are high achieving, people who, they often things like anxiety and the desire for control, you can channel them in a functional way or you can channel them in a non-functional way. It's not to say that you should never be in control in your life, but it's liberating to accept the situations where you're not in control if you have chronic illness particularly. So my kudos to
For
you for being
sure.
open to that because that took me multiple times of multiple therapists till I actually was willing to let go of control.
And I mean, I will say, like, again, credit to my husband. He was like very encouraging of therapy, and especially because the SSRI was just not going to happen for me. I think that's it. That's the right answer for a lot of people, and it maybe could have been the right answer for me if the stress in my life was not caused by a different medication. Maybe
Oh,
I was so
yeah,
averse to it. I couldn't. So it was like you got to do something, and it was like
yeah.
I guess I got to do therapy.
And they can
Um,
go just like with, natural methods and medications for rheumatoid arthritis. You can do like I take a small dose of an SSRI for as maintenance for my anxiety and like panic attacks. And I do the work in therapy too, and it just the anxiety meds for me help take the edge off, but I just wanna normalize, I had the hardest time getting my body adjusted to them as well, and I think if I had been on anxiety meds a long time ago, and then I stopped them, and then I started them again, and I remembered that the first time they also were hard to get on, so I had to push through that initial, like, week or so of feeling worse before it gets better. It was like I had that comfort of knowing that that had happened before. But I almost the first 2 after the second night, I had to be like, I am out of my mind. Like, this is
Yeah,
not
it makes you
okay.
feel, like, jittery kind of
Yeah,
first, I
yeah.
think, right?
So,
And like you said, yeah. No, yeah, I agree with you.
no, 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 and sorry, I'm like, I wanna make sure I'm like, "Wait a minute, I need
No,
to
it's
stop talking about
okay.
my story." But no, I'm thank you for sharing about going to therapy and what helped you, and, I also wanted to give you a chance to share. We're not gonna be able to do all the rapid fire questions, which is totally fine because 'cause they're not actually rapid fire, they're, like, long questions. But the one, I wanted to ask is, what are some of your best words of wisdom or things you'd want to say to somebody who might be newly diagnosed either with psoriatic arthritis or with palisaded neutrophilic granulomatous? I can't say it.
Yeah, I can't say it half the time either. I gotta see what I said this, I don't even remember. Oh, yeah, yeah, I
Jurassic
love
Park.
movies. Yes,
Yeah.
yes, thank you. I love movies, that's, like, something you would know about me almost off the bat. So, I, like, derive some of my wisdom from movies and quotes that stick out to me or morals or lessons, and Jurassic Park, I have to clarify, 1993, the original movie, not, like, the Jurassic World,
OG.
the first
Yes.
Jurassic Park. And that was it's a book I love too by, the book is by Michael Crichton, but the movie's great, and I was first exposed to the movie. There's a scene in the movie where the guy who is creating Jurassic Park, the dinosaurs are out, bad things are happening, everything's already chaos has already ensued. And he's saying to Laura Dern's character named Ellie in the movie, he's like, we if I do this and if I do this, I can still get it back under control. We can still like people have died in the movie at this point, and he's like, we can still open, it'll be fine. And she like has to kind of have like a big come to Jesus moment with him, and she said, "You never had control. That's the illusion." And
Mm,
for somebody like me, and like you've described as well, that was also like, ugh, you have to accept sometimes. And like you said, not in all aspects of life. Of course, there are aspects of life that you have control over certain things. But as with chronic illness and anything, there's the dinosaur or something in your life that you can't control a dinosaur. You think you can train it or get it to stay behind an electric fence or whatever? I got news for you. Like vasculitis ain't it. Like I don't know. So you said for in the realm of newly diagnosed, you're gonna feel like, what did I do? Like, what did I do that this happened to me? And what could I have done? And what if this? And what if that? And you don't have control of the fact that that happened to you and you didn't do anything wrong. Like, all you can do now is choose how to react to it. And I'm not saying it's always going to be like, I was over here having panic attacks myself. You're not always going to have like the perfect day, but you just have to move forward, which brings me to the other quote I mentioned in my response to you, which was from just totally 180 on the movies. Now Frozen 2, the
yeah.
cartoon.
Yeah, I love that
There's like
movie.
a yeah, there's a point in that movie where Anna is like she's at her lowest point and she could choose to despair. She could choose to give up and despair and just lay down and say I've lost, but that's the point in the movie where she sings this song, and it's I think the title of the song is this too, but the chorus is just do the next right thing. And that resonated with me too because it's when I'm at my worst when I'm feeling very overwhelmed, and when you're trying to process something like a new diagnosis, I would understand if you feel overwhelmed because sometimes it involves, well, we're going to have to refer you to another doctor. You're going to have to make all these other appointments. You're going to have to start these new medications. You're going to have to maybe make some lifestyle like changes or modifications. And so, what I would say to those people is just do the next right thing, meaning pick a task, do one thing today. So I used to be the kind of person too when I was younger, I'd have a to-do list with like 20 things on it for the day. And then somebody, I don't remember where I read this or who told me this, but don't ever have more than 3 things on your daily to-do list.
Yeah.
Because you're kind of, you don't know what's going to happen. This relates back to control too. You
Mhm.
don't know how your day is going to go. Just do the next right thing and just pick one task. And I think little by little by little, it'll start coming together and you're going to be okay.
That's such particularly good advice for newly diagnosed, because I think a lot of people are like, well, how am I going to do this? And what am I going to do? And what about my career? And what about my family? What about having a kid? And you're like, whoa, one thing at a time. You have to give yourself that time and space and that patience. Last question. This is a big one, but I know you wrote some notes out before, which are really great. What does it mean to you to live a good life and thrive with chronic illness slash psoriatic arthritis?
Okay, I have to refer back.
Yeah.
Um, I think that yeah, yeah. So I'm a big proponent of yoga. I do love yoga,
Mhm.
and something, even if you don't want to or if you don't practice yoga, there are still lessons to be learned from it. And one of it is to honor your body. That's a thing that I hear a lot in yoga, and it's just acknowledging how amazing your body is. I'm so grateful for my body. My body has challenges, but I'm so grateful for the things it can do. It will never cease to amaze me. And with that, in the theme of honoring your body, though, also don't push yourself past your limits. Like we have to like I think I was experiencing this sometimes in trying to push through working in the hospital when I couldn't, like when I was in so much pain, or when I was working that day and then after work I went to the hospital, like maybe I should have stopped a little sooner and said, hey, my elbow hurts. Like it's okay to acknowledge limitations, but also like just celebrate and be grateful for all the wonderful things you can do. And also I try to focus sometimes too on the people around me, and I think life is about relationships and connecting with people, and acts of service and serving other people. That's when I'm like the most joyful and happy. So it's kind of a mixture of that. It's like honoring your body, and you do have to take, it's the oxygen mask thing on the plane. You have to put
Mhm.
on your own mask before you can help anybody else. But also, I really believe that life is about your relationships with other people and connecting with people and helping people. And that is where so much joy can be derived from. I found that in having a child and getting married and my friends and my work and patients I've met. So that's,
Yeah.
life is crazy, but it's great also.
I love it. No, I'm a very extroverted, like relationship oriented person. So I really resonated with that as well. That definitely gives me energy and gives my life meaning as well. So I think that that's really beautiful. And where can people find you online if they'd like to connect further?
Yeah, so I don't have like a huge online presence, but I've just forayed into sort of blog writing. I'm on Medium, which I know you said you'll link, so that's where you'll find me
Mhm.
there. And then I'm on Twitter, where it's just where I would post things that I would write to. And I believe my Twitter handle is at Rosemary MSN, because it's mostly directed at my healthcare interests and such. So that's about little
Yeah.
shout out to my nursing.
Yeah, I love that. Thank you so much. I mean, again, you mentioned that it's or you didn't even if you didn't mention that, it can be hard to tell your story. I mean, I know that this isn't the same as feeling like a circus animal because we're taught you have the microphone, you're able to talk about it, but it's still I'm often surprised. I tell my story so often, it still sometimes can hit you and emotionally when you tell it again. And so I appreciate you taking the time to share such a challenging journey, but ultimately one that, you're using your platforms now to educate others. And that's a really beautiful thing. So thank you.
Yeah, well, thank you, and I mean, it took me years to sit down and write
Yeah.
it down, and writing it out did feel like I got it out. It was hugely cathartic, and yeah, thank you so much for having me. I really, really appreciate, and I really appreciate everything you do. So thank you for your work
Oh,
and your platform. And like, I mean, I just like you and I again are similar in connections in life, and I just think it's beautiful the way that you can connect with people. So thank you
oh,
so
thank
much.
you. Yeah, I'm really glad that, just for people listening, like she contacted me out of the blue on Instagram. So you never,
Yes.
you want to share your story. I do now have a like application form that I send people sometimes if I don't already know them. In your case, you sent me your blog post and I read that. I'm like, oh my gosh, she'd be perfect. But it's an application form because unfortunately, I do get people who want to share their story, and it turns out that they're just trying to sell like a supplement or something, which I don't promote any supplements. Because it's just way outside of my scope and frankly in my interest area. So, I need to vet people who come on the podcast, but it's a Google Doc. And if you can email me at info@myarthritislife.net, I'll send you the little Google Doc. If you want to share your story, you can apply to this rigorous application, which is me reading what you said. But anyway, thank you again, Rosemary. I know people are going to have lots of positive feedback on this episode. So we will connect further later, and I hope you have a good time with your little baby, and we'll talk to you later. Thanks. Bye.
Thanks, Cheryl. Thank you so much. Bye-bye.